Hey, what's going on, miners? Welcome back to Miner News. So this week we're actually going to be talking about upcoming finals week and this just past unfortunate football game that we just had. Man, oh man, So I'm having some breaking news coming in here. We're actually having the UTEP School of Pharmacy come on, and they're having an identity crisis from pharmacists. Let's go ahead and bring them on.
Give it up for them.
So I believe they have a project that they've been working on there. Want to tell us a little bit about it? You guys want to go ahead and introduce yourselves?
Yes, definitely. Hi, I'm Amanda. I'm a P1 at the UTEP School of Pharmacy.
And I'm Marissa. I'm also a P1 student at the School of Pharmacy.
We actually have a podcast called the Legal Drug Dealers Podcast, where we talk to other students at the School of Pharmacy about professional identity and how we can develop a stronger professional identity as we become future pharmacists.
Is there anywhere where you can tune in to watch the podcast? Where can we watch it?
Yeah, so we interviewed various pharmacists, and our podcast will go live at 7 Mountain Standard Time on YouTube.
Awesome. I can't wait to tune in later tonight.
Okay, on behalf of all of our staff,
Go Miners!
Hey, what's going on, guys? My name is Sebastian. Welcome back to the Legal Drug Dealers Podcast. A little bit about myself is I'm a P1 student. I've been a pharmacy tech for 4 years, so I've been working here, been around, the pills a little bit, and I want to make a breakthrough in industry or hospital pharmacy one day. And my other legal drug dealers are going to tell you a little bit about themselves.
Hi everyone, I'm Amanda. I am a P1 student at the UTEP School of Pharmacy. Like you guys, I have been working in retail pharmacy as a technician for about 5 years, and I'm excited to learn more about professionalism with you guys.
Hey, what's up, guys? I'm Beyonce. I'm currently a P1 student. I have not had any experience in the pharmacy world before, but I did just graduate from UTEP about a year ago, and I'm as well glad and excited to see what my fellow drug dealers have learned from the interviews that they gave.
Hello, I'm Marissa. I'm also a P1 pharmacy student. I also don't really have a background into pharmacy. I have done research in pharmacology, but nothing too hands-on in the terms of community or hospital. But I also look forward to learning about professional identity and how different pharmacists even look at their professional identity through these interviews.
What's up, guys? I'm Keanu. I have been a pharmacy technician for a year and 3 months. I work at a hospital pharmacy, and I'm currently a P1 at the UTEP School of Pharmacy.
Yes, that's a little bit about ourselves, guys. We're going to be some drug dealers, legal drug dealers one day. And what we want to talk about, you guys, today is what is the professional identity of a pharmacist, and how do we as P1 students get to where these professionals are now, and be great where we're going to be, whether it's hospital or industry or community, whatever the case is. So we actually went out into the field for you guys. We did a little bit of research ourselves, and we explored what these professionals had to say in the field. So me, I do work in a retail pharmacy right now, so I was able to interview some retail pharmacists. I also went to a IPPY rotation out to Walmart and was able to interview some pharmacists there. And I was also able to interview a pharmacy manager. So I'm going to give my perspective of what exactly professionalism through the eyes of the interviewees that I had. So a couple of things that I wanted to talk about that I thought were really important were just, I think the first and foremost is just integrity. Integrity is just being able to do the right thing when nobody's watching, when everybody's watching, behind closed doors, and I think that's just really important for a pharmacist to have, and that's what they told me out there. A retail pharmacist in Walmart was telling me about that, and it continued to get reiterated throughout my other 2 interviews as well. And so I think it's a really core part of what the professional identity is of a pharmacist. What do you guys think?
Yes, definitely. So I interviewed 2 retail pharmacists, my pharmacy manager, Erin Moran, and my preceptor, Gary Reina. What I did get from both of them is that part of building your professional identity and professionalism is also integrated into what being a pharmacist means to you. So definitely keeps you in that line of professionalism, respect, and integrity as well.
Yeah, no, definitely. Respect is a huge one, I feel like, as well. I got a lot of that as well. Is you got to be able to not only respect but communicate with your peers, whether it's other pharmacists or technicians. That way, we allow for the best patient outcomes. So, I definitely think that was important. Another big core thing that I found that was common between all of my interviews was empathy. You got to be able to show empathy to your patients, to show them you care about them. I think that's a big thing that I have seen where some pharmacists lack it, and it does, affect patient outcomes. Patients leave, and they don't exactly feel happy with, what they left with. They don't exactly feel like, I guess, they were cared about enough, which is what, when all of us are sick, that's what we really want, right? We want to know that we're taken care of by these professionals that say that take an oath to take care of us. So I thought empathy was huge. What do you guys think over there?
I also think, along with integrity and respect, I also think innovation and accountability are really 2 big factors for having values as a pharmacist. So innovation, a lot of the times people don't know what it is a pharmacist does. So during my interview with Dr. Medlin, we talked about innovation and kind of how, since not many other healthcare professionals or even patients know too much about what pharmacy is, you have to be innovative and find new ways to work with the healthcare team, and it has like a huge impact on patient health. But also accountability for just being responsible for counseling patients and making sure that they receive their medications and making sure that they use it effectively and safely as well.
Definitely.
I actually wanted to add to that what Marissa had said, that not a lot of people know what pharmacists do. And actually during the interview that I had with Dr. Loya, and one of the first questions that I had asked her, she had mentioned how she didn't even know when she was younger what a pharmacist was. She just mentioned that she knew that the pharmacist was either going to give her a pill or a liquid suspension, which was going to be easier for her to swallow. So I feel like professional identity also leads a lot to,
I guess, steering away from the misconception that pharmacists just count pills or count liquids. Like, we have a lot more to do with patient care and the decisions that are made in clinical settings, like medication treatments and stuff like that. And I think that's also a big part of like what we're trying to do here is like to tell students like why it's important to build your professionalism and your identity, because you're also like putting our profession out there, like steering away from those misconceptions that we're just in retail,
Yeah, I definitely agree. One thing I want to kind of talk about was the innovation aspect Marissa brought up. I didn't really get that with my retail pharmacist, so maybe that was different across from, an academia standpoint and a retail standpoint. I feel like some retail pharmacists kind of just are settled in the idea that they're going to be that forever, and I think the mindset of maybe an academia pharmacist, or a professor is just different in the sense that they want to continue to push the boundaries of what they know and what we know as a profession. And I think that's really important to professional identity, is we should all kind of have that, I guess, drive to want to help push our profession forward for the benefit of all of our sake. You know what I mean?
For sure.
Another common theme that I did kind of find was, at least from my pharmacy manager, was just some like standard things of just being on time, showing respect, and in a sense being a role model for the people around you, and not even also like the text of people around you, but like patients as well. Someone that patients can look up to as well. So that way, I guess, you can inspire not just technicians, but patients and other people in your community. So I think that's really important, is just being able to maintain a standard of just, I'm going to be there on time because I know I have to, because it's right. That's, it kind of ties in with integrity as well. But none of that, but just if you're a manager, you got to be able to, I guess, lead by example as far as, what you want from, those people that you're also working with.
Oh yeah, I definitely saw that with the pharmacists that I interviewed. Structure is like one of the most essential parts of their life, not just their work. They really like need it to be able to know what laws, what rules they're supposed to follow, or know what the protocol is for this situation. Because at the hospital, it is utter chaos. I'm just kidding. It's not that horrible. It's just, there's a structure to how the shifts usually go, but they never go that way because there's always something that comes up. And I'm sure you guys have experienced that
Of course.
in retail even more so,
Yeah.
because you're interacting with patients way more.
Yeah.
I can only assume how crazy that is.
Yeah, and I think also like a big part of being the pharmacist is you kind of set the tone in the pharmacy. I think it could go really any way, academic, retail, or clinical pharmacy, like hospital pharmacy. Like if the pharmacist comes in a certain, I guess, mood or like kind of tense, it kind of sets the mood, and that also feeds off into your text. And also maybe you can make an impression on your patients, and that can really determine also like the level of trust you get from your patients and your team. And essentially you want to have a good relationship with your team so that you could have a good workflow and overall good
patient outcomes at the end of the day. That's really the goal that we want, is to find better ways to help our people, our community more.
No, yeah, I agree. And I feel like just, like you said, Amanda, like in terms of the, I guess, vibe of the pharmacy, right? It depends on how your pharmacist really interacts with everyone around them and like their values. And I feel like that's something that we should all try to incorporate, like being comfortable with communicating with just people around you in general.
Actually, I guess adding to like the vibe, I guess, of the pharmacy during my IPI, I noticed that the pharmacist, I know she like, if she had her job, she would do it, but she had a very good communication and relationship with each one of the pharmacists, pharmacy technicians and pharmacists that were there. So I could definitely see how a pharmacist can really set the tone, and according to how not only that pharmacy in specific, but just how your shift is going to go and how everything will eventually flow, and if you're going to stay there, if you're going to want to leave.
Yeah.
Yeah, and just to go back on that, because I also think that, like, how pharmacists, like, mood and, like, how they treat their job also impacts, because I know there's a lot of techs, like yourselves, that look for their pharmacists, and because that's something that you want to do in the future. So if you see a pharmacist, like, in, like, the retail aspect or hospital aspect, that they're like, oh, complain about their job, it kind of deters other people that want to go into that profession and be like, oh, maybe I don't want to do that because of that they see just a negative or hear just negative things. So by being positive and just bringing good vibes, it helps people being like, man, they really love their job. That's something that I want to do.
Yeah, and I think that like they're the role models essentially.
Yeah.
And not just for, I mean, it's important for students because that's where we're headed. We want good role models, good preceptors, good mentors, but also like for younger generations, like a lot of younger generations don't even know what pharmacists do.
Yeah.
And I guess like also it's part of your professionalism in the pharmacy. You also need to be able to set the tone when like there's a stressful situation. Like you need to know how to be able to de-escalate situations and keep your workflow good.
Yeah, I think all those things that you guys are saying are really core components of, you know, what makes a difference between a pharmacist that's gonna, you know, I guess help innovate and expand care than one who's just gonna, you know, maybe just collect a paycheck or just do bare minimum and, you know, things are gonna stay the same. Another thing I kind of want to talk about was they got to be able to have like we kind of talked about communication and interprofessional skills. So being able to, you know, like you guys are saying, speak with your techs, being able to kind of lead a team. I think another thing that they talked about for me was being a leader. You know, being able to not just want yourself to be better, but show your team around you to also be better. You know, some things that help, for me at least, with the interviews that I got, that helped pharmacists maintain these standards. It was just they were passionate about the things they do. They enjoyed the knowledge that they have. They wanted to, you know, whether it was an experience that they had with their family member or, you know, just for the love of science, you know, they were passionate about their job, which helps them to, I guess, drive their will to not lose their job, you know. What do you guys think about that?
I think going off of like the innovative part, the pharmacist that I spoke with did talk about like keeping an open mind and staying up to date with recent events, especially because there's always new stuff coming up, especially in pharmacy. You want to keep an open mind, even though you become a pharmacist, you don't stop learning. Like there's always more to learn, and that's also going to affect you in your job, you know?
Yeah, definitely.
I just want to say that also, like, with innovation, I also think it's important for pharmacists to not get stuck in a certain way, because I understand that, like, many, like, pharmacists that have been doing this career or profession for several years, they'll say, like, no, I want this a certain way because I've been doing it a certain way. It's also important for them to expand their mind and open up to ways which it is newer, but it could be better in a certain way and more efficient for the patients and for the pharmacists and pharmacy technicians as well.
Especially when there's like new laws in place, and that's gonna affect your work one way or another.
Mm-hmm. Yeah, I mean, I think the law, being able to uphold the law and like show empathy is a pretty big thing also. You know, being able to show you do care about your patients and but knowing right versus wrong and knowing that what you can and cannot do. What other things do you guys, interesting things that you guys find from your interviews? Do you guys want to talk about? Anything?
I asked my pharmacist I tried to get some, like, I don't want to call it random, but like kind of out there questions.
Yeah, out of the box, you'd say.
A little bit away from this. Like I tried to ask them about AI and stuff and like how they see pharmacy changing in the future with that. Something interesting that I found was one of the pharmacists actually uses an AI that is verified for healthcare professionals, and you need an NPI to even access it. It's called Open Evidence. And he was showing me how it's kind of like how you can go to ChatGPT and ask it a question. It kind of does that, but it looks into different medical resources, like different research, what do you call it?
Papers.
Yeah, research papers, I
Yeah,
guess.
studies and whatnot.
Different studies, yeah. And it really just takes information from there to answer it. That's something I found really interesting. I had also asked Victor, which was also one of the pharmacists that you had interviewed.
Super cool guy.
Yeah, super cool guy. Awesome. He helped me with my IPI. I asked him about AI, and he was showing me how like they use it at Walmart, how there's like an AI surveillance system. I don't know exactly how it works, but it helps. Like,
told you about
helps,
the
like,
cams, dog?
Keep track of the what?
He told you about the cams?
He told me about the cams. Little secret. You know, I had to get it out of him, but he got the.
It's pretty interesting, man.
He gave me the inside scoop.
Yeah, it's like you're saying that. What was it, like the medical provider AI kind of thing? I think that's really interesting, and I mean, I don't think it'll take our jobs, anytime soon, knock on wood, right?
I don't.
But I definitely think it's gonna create more pressure for us to maintain, that professional identity as far as integrity goes, because, I mean, we have to be able to do our part as well, not just get lazy and rely on AI if in the case it becomes a bigger part of our jobs. You know what I mean?
No, yeah, 100%. And one of the things that Victor said is he doesn't think it's really going to take jobs. He thinks it's just going to shift, like, what the pharmacists are actually doing. Like, he feels like a lot of times AI can maybe handle more of, like, the medication order verification side of things. And he feels like pharmacists' roles are going to shift more towards maybe medication management, where they're actually, like, calling up the patient and being like, hey, take this med instead, it might be better for you. It might shift to, like, actual physical things that don't have to do too much with technology.
I mean,
What do you guys think?
I'd love to get prescriptive authority. That'd be cool. You know what I mean? To write scripts. I don't gotta write controls, but if I could just write scripts, I think that'd be cool. And I'd be pretty happy with that.
Yeah, I guess like in like terms of like what could be new for pharmacists, like it's even retail settings have more like a little bit, not so much clinical, but a little bit more hands-on things that they can do, like the blood pressure testing, vaccines is something that wasn't always around for us. The A1C testing, that's something that they can do too. So a lot of like little things that it's changing the way pharmacy is viewed, I think. And
Yeah, just like kind of shifting the, not just how we're viewed, but just like our role as well as, we're getting, it seems like we're getting more of a clinical role, which is kind of, I feel like, what we're really after in pharmacy, at least some of us, Another thing I did kind of want to talk about was, I did ask my pharmacist, like, what are some key things that, like, helped your development in shaping this professional identity? What made you tell me everything you just told me during that interview, And so they kind of told me a little bit about personal experiences, how they, again, like we're going to do during school, is they've gone on IPPEs, they've done their APPEs, and they've talked to pharmacists, they've asked them questions about, how do I be, how do I act? If a tech, tells me one thing, how do I respond, stuff like that, I think helped to shape their professional identity. Another thing was, and I found it pretty interesting because I'd never heard of a mentor prior to coming to pharmacy school. I mean, I'd kind of heard like, oh, an apprentice, but whenever I hear apprentice, I just think like a wizard, you know what I mean? And, I never thought of it as like a super serious thing. So when they started talking about mentors and they told us, hey, get a mentor, it's a good thing for you. I kind of started looking into it and I asked about it as well. And they told me that, my pharmacy manager, she was telling me that it was a big part of her development is she got a mentor so that way she could ask them any questions she had about school, about, how do I study, this or that. And it ends up as, some of them, end up very well, some of them maybe not, but it just depends who your mentor is and what you want to get out of it. But yeah, I mean, they ended up as really good friends, and even as she became a manager and, a new pharmacist, she was still able to reach out, and even like today, she could still text her mentor now and ask her questions, So I think having a mentor was huge for her development of the professional identity.
definitely.
And I think that just like having a mentor just like makes going through even the process of pharmacy school a lot easier because they get to share their experience with you that helps ease the burden and guides you through pharmacy school.
Yeah, it kind of gives you an idea of what to expect almost, is, I mean, when I was applying and stuff and I had no idea what was going on, it was kind of scary, it was like, what am I getting myself into, Am I ready for this? Is this a lot? Is this too much? And so I think, having a mentor that's that now is a pharmacist is, a great way to just, help you to get through school, and help you, I think, even to become really passionate about it because And I think a little bit is going to rub off on you, you know, because you're going to be asking them questions so much. And so, you know, if you have a good mentor, you'll probably end up as a good pharmacist, and your professional identity will, you know, shape itself in a good way.
And also, I feel like not just mentors, but also having hands-on experience and first-hand experience as well. I had interviewed Dr. Sayas, and she mentioned how she was actually in the ASAP organization, and then that she volunteered in many clinics. She mentioned that she volunteered in homeless and Indian clinics, but I feel like having that like hands-on and first-hand experience really expands your professional identity, because it as well helps you view as pharmacists that they're not just behind the counter and just prescribing medication, not prescribing, giving out medications.
Yeah.
Yeah, I think it also like expands your perspective on the type of patients that you're going to be treating. Kind of helps you understand their circumstances, which also can impact the kind of pharmacist you're going to become and how you're going to treat your patients.
No, yeah. I definitely think I didn't get any of the clubs during my interviews, but I think hearing that now makes sense about how it could definitely contribute to their, you know, professional development and their identity altogether. Because yeah, I mean, being able to have those opportunities for those hands-on experiences, I think it's great. I mean, it's one of those things where you're gonna go out there and for firsthand you're gonna see, oh, this is what it's about, you know. And I think there's no better way for you to, I guess, experience it and learn from it than, you know, that on-hand experience.
I guess kind of going off and like, so a question that I asked the pharmacists that I interviewed was if there was ever a time they felt their identity or like their professionalism as a pharmacist was challenged, or like they had to doubt themselves. And both of them kind of described a moment where they had to kind of bump heads with corporate, especially in retail settings. Like, at least for Dr. Reina, when he worked, not anymore, but back then when he worked in retail for Walmart, they kind of made it to where they were kind of enforcing that they avoid allowing the dispensing of control medications, because they wanted to keep the numbers so low. And it's like understandable under the terms of like, you know, there's the whole opioid epidemic. And but they were like to the point where they were saying like, why are you dispensing so many C2s? And it like put him in question, like, am I missing something? But then as a pharmacist, like, he knew to review everything. Like, he looked at everything, the files, and it's like, this is a cancer patient who needs this medication. They need the pain medication. Like, I'm not in the wrong to dispense this. And as a pharmacist, I have that decision to make. You know, it's not too early. It's not, everything is in line with prescribing. And also with my pharmacy manager was like, when it comes to corporate, they focus so much on sales and the retail part of it, getting the numbers out. But when it comes to like what is able to be dispensed, he has to think about, he has responsibility over the health of the patient, and he should be able to decide what could be dispensed and what cannot without it being questioned like, oh, we need to meet our numbers, you know?
Yeah, I feel like I've also experienced that firsthand working at retail pharmacy. And, you know, I get it. They want the numbers, you know. Who doesn't? In an ideal world, you know, we could get the numbers and help people. But realistically, it's, for us at least, we're the clinically educated, you know, people, we're the professionals. We went to school for this, and I think that, yeah, we should be able to make sure that we're using our clinical knowledge to dispense meds if they are needed, you know, and we shouldn't have to be held back by, you know, business metrics because this manager doesn't want to, you know, spend this money for more controls, you know. I think the patients definitely come first than a business. But I guess that's kind of what some of the things that I kind of thought about is like, well, how can we make a business, that is patient first and not, I guess, it still be, profitable, and you wouldn't be just losing money on it. So that's just a kind of idea that I thought about. I don't know what you guys think about that, but yeah, I definitely think that that's important.
I do too. I feel like it's good that like you want to like you have things that you want to do when you become a pharmacist, right? Like you want to like change things up. You have a fresh point of view of like how things should be. And that's something I wanted to ask you guys. Well, first of all, why did you guys choose pharmacy? And like, what about your point of view on pharmacy has changed throughout your guys' journey, either through starting school or starting to work, maybe your IPI experience on your rotations? What changed? Like, is there anything crazy?
I guess for me, it was just, it was always about school at the end of the day, sports, and, we're always there and everything in between, but it was more just like school focus and where are we going to go from there. And it was high school, there was a opportunity to become a tech, and I love math. Math is really easy for me, comes pretty automatic. So it's just one of those things where like I found out which pathway was going to lead me down to do something that I enjoy doing, because reading isn't the funnest thing in the world. I prefer, I guess, reading numbers than letters. And so I just decided, I'll go down this pharmacy path. And working in the pharmacy, it helped me to realize that, hey, these people help people, I wanted to be a doctor a long time ago. I still want to be one day, but we'll see where our journey takes us. But I guess this was my outlet to be able to do something I loved and also fulfill my wish of being able to help people in this world.
Because for me, I always knew that I wanted to do something in healthcare. Because my mom was a nurse, so I wanted to go the nurse route. But I realized I still wanted to do something in healthcare, but I realized that wasn't for me. So I tried to find something that was in my interest, because I did like chemistry a lot during high school, and even during my undergrad, I did a bachelor's in biochem. So, which was also guided because I kind of knew that I wanted to go into pharmacy. So that's where like the two paths like kind of aligned, healthcare and interest in science. But what really changed is that I didn't, like through my first-hand experience, like through my IPPs, I realized that there's so much, especially in community, that there's so much that goes on behind the scenes, like verifying medication and checking all the drug interactions, like making sure that the patient's well-being is the first priority. I think that was something that was completely new, and I was really glad to experience.
Yeah, I think at least for me, it was mostly like being a tech and then just taking the next step forward. Like I wanted to continue with school, but I also wanted to keep doing what I already do because I like my job. But I guess also like part of like shifting from tech to pharmacist, a lot of some, not all of course, but of course an interest is you're going to be making a decent amount of money. And although that's awesome, right, you can't just make it about the money. Like you have to, it pays well, but you should also be in it like because it's what you want to do, which is like why I went into pharmacy. It should be something that you see yourself doing years from now, like you want to stay in that profession. And ultimately, like the goal is like you care about the patients, you want to be in healthcare to help the patients, to make a difference in their lives one way or another. And that's what should really drive you in your profession and to really love what you do.
For me, I think I always also wanted to be in the healthcare profession, and I actually did switch my major to nursing, and I never really got into the program. I was still like in the prerequisites and everything, but I ended up switching back to biological sciences, which is what I graduated from. And then from there, and actually in one of my labs, is when my lab partner mentioned the pharmacy program here at UTEP. I didn't really know about it. And then I guess I did a deeper dive into it about like what pharmacists do, because I didn't really have any experience towards it. But that really, I guess that opened my mind to another option, because I wanted to go to dental school. So that really opened my mind to see like, oh, maybe I should do this. I mean, it's still in the healthcare community. You're still helping people. And then, so I had that experience. And then as well at home, I have a cousin and he's taking several medications. So seeing how much the pharmacist plays a role in his life, and seeing how like those drug interactions shouldn't happen, and seeing how sometimes his own physician prescribes certain medications that shouldn't be prescribed. So I would really like to as well make that change and be like, help make that change and help someone prevent a really bad thing to happen.
Yeah. One thing that I kind of have fun doing when I talk to people is like whenever they tell me they don't feel well or whatever, like I'll ask them and stuff. Like, well, what's wrong? Well, do you do this? Well, do you do that? You know what I mean? So I think I kind of also enjoy just being able to talk to people and just like give them advice, you know, and for them to be like, hey, that guy helped me. I'll go ask him, you know, if I need something again. It kind of makes me feel, I guess, if it feels wanted and needed for people to be like, yeah, let me go ask Seabass. Let me go ask Seabass, you know, this, you know. So I think I get a little itch out of that, which helps me to, you know, really want to become a pharmacist. I want to be able to not just help my family and friends, you know, but, you know, random people I might run into, you know, on the street or whatever, at the store.
Yeah. I completely agree.
I think kind of going back a little bit to what Beyonce said about how sometimes even being the physicians, like they might prescribe two prescriptions that will interact. When I was talking to Dr. Reina, he did like emphasize like we're a bridge between doctors and patients. And, you know, we're there for the patient, but we're also like, there's been times like he described that hospital physicians, like in the ER, they'll call him like and ask advice about medications, like, oh, I have this patient here, this is the case, between these two medications, what do you think will work more? And that's something that he said makes him feel good as a pharmacist, that he's there to represent, like advocate and help the patients, but he's also there to educate the doctors and help them make the right decisions for the patients.
Yeah, I've seen it so many times where doctors, you know, they might send a script in and it's for like an absurd dose for a child, and we are like, well, I mean, if we weren't here, then this would have just gotten dispensed, you know?
Mm-hmm.
So yeah, I think that's just really crucial for a pharmacist.
Yeah, that's actually something I asked my pharmacist about, which is like how they interact with other healthcare professionals. Because in terms of hospital pharmacy, where I work, a lot of times they don't really talk to patients like you guys do at retail, right? They don't really interact with the patients as much as they do like nurses or the actual MDs that are there that are prescribing medications. And I feel like they're always kind of butting heads. Like, I'll pick up the phone and it'll be a doctor, and I'll pass it over to the pharmacist, transfer it over, and they'll be like, oh, now I have to talk to this doctor. And then they're always kind of like having to explain themselves and prove themselves to the doctor that they know medications and stuff. And that's something I see a lot. And I feel like that's something I wish would change a little bit, that pharmacists would get a little bit more respect, because they know they're like the drug experts, right? They are the drug experts. Mm-hmm. So I feel like they should be given more respect in terms of like being seen as someone who's higher up there in the hierarchy of healthcare professionals, which I think it kind of sucks that some people look down on it, even though they're doctors. It's a full doctor's degree, you know?
Oh yeah, I definitely see where you're coming from.
I feel like not just as well as respect from doctors, but from patients as well.
Well, the lights just shut off.
I think we have control over the light, don't we?
that not just like I mentioned, not just respect from like doctors, but as well as from patients, because patients as well sometimes I feel like they don't see pharmacists as a primary or like a really important doctor. Like they don't really know what goes behind the scenes. Like they think that the pharmacist is just the one that like gets their medication ready and like has it there for them, but they don't actually see what goes on behind the scenes and verifying all the medication, seeing that the physician didn't prescribe anything that shouldn't be taken with anything else. And as well as like hospital or like clinical, one of my professors that I had interviewed, she mentioned how they work at a clinical pharmacy, and how she's one of the first, when a patient goes in, she's usually one of the first to like go inside with the patient, and the patient doesn't expect a pharmacist to come in.
Right.
So she has to actually like explain and advocate for her role as to the reason why she's there and why she should be there, not just why she's there, why she should be there, and helping them get towards their health goal, whatever it could be in their situation. So I feel like not just, as I mentioned, the respect between other healthcare workers, but patients as well.
Yeah. Yeah, very well said. I love all the ideas you guys got from those interviews. What other kinds of things do you guys did stand out to you guys?
I guess kind of going back a little bit to that is that even though we see that a lot of like other healthcare professionals don't really see pharmacists as like important, like Kiana was saying, or just kind of their value isn't as, like they don't see value in pharmacists. But during my interview with Dr. Medlin, we were talking about what separates pharmacists from other healthcare professionals, and he was saying that even during his rounds in UMC, that once those healthcare professionals actually know and get used to like what pharmacists do, they're actually very surprised and cherish how important the role of a pharmacist is and recognize how valuable their clinical input is.
Yeah, I mean, pharmacists definitely need to, they definitely deserve more respect, especially from other healthcare professionals. Most definitely.
They need way more credit. They do so much, and because it's all behind the scenes, I feel like they don't get much credit at all. And that's actually something that like I struggled with, like choosing to get into pharmacy, because choosing to go into this school was like a decision made after like a whole existential crisis, you know. Like I tried to make a point to interview every single pharmacist that worked at the hospital, to see what their thoughts on joining pharmacy school right now would be, if it's worth it, if there's other four-year degrees that would be better to look into. And for me, it ended up being pharmacy was like the best option for me, I feel like, and it's something that I wanted to do. But they have this running joke, like every time I walk into work, they'll be like, "Hey, so are you a MD yet? Are you a DO yet?" And I'm like, that's not what I want to do. I really want to try to. I like this field. I like getting to learn about the chemistry of different drugs. That's like one of my favorite things, like the actual mechanism of action of different drugs. And I like getting to talk to the different pharmacists at work about that. But that's also something I see with a lot of people who do pharmacy as a career. A lot of times whenever I would ask them, should I do pharmacy, or was pharmacy your first choice? I feel like at least 3/4 of them said, I actually wanted to be an MD, to be a doctor, but they chose this route because whatever happened, they got into it first. They saw it as something more interesting. And I feel like they should give themselves more credit because they do so much. They really are important in the way like treatment is given to patients.
Well, I think you made the right choice with pharmacy.
Yeah.
I do too. It's
Oh.
The lights just came back on, guys. Welcome back. It's actually morning time. We've been talking for actually all night. This is a really good pilot episode for our podcast. what other things do you guys want to go over? What kind of things do you guys find interesting? I feel like we hit a lot of the nails on the head here with our professional identity. I feel like pharmacists overall have so many good qualities about them that they do deserve more respect, and it's one of those things that's why they talk about advocating for ourselves so strongly. Is we are the next generation of pharmacists, and everything that we're hearing from pharmacists now, we should be able to hopefully change in the future, so we don't have to deal with that stuff, and so what any other things, any other
I guess
comments?
just adding into that is like when you're forming your professional identity, it also has to align to the type of field in pharmacy that you're working in. So like retail pharmacists, they're not so much about like being addressed as doctor, more they like being addressed by patients and colleagues by their first name. And I think that's something that's specific to retail settings or like maybe even hospital. But in terms of like academic, it could be really different because you're with students and other colleagues that are also professors, so it's a different standpoint where you're addressed as a doctor.
So when we graduate, am I gonna have to be what's up, Dr. Gutierrez?
Yeah, because you're my peer.
Yeah.
But first name basis is okay too.
No, yeah, I definitely think that it's gonna differ throughout the different industries you're in. I mean, I guess the kind of thought that comes to mind is like if you're in a clinical setting, I think call me doctor because I'm doing doctor duties. Not to say I'm not doing doctor duties in a retail setting, but I guess it just feels a little bit different when you're in a hospital than when maybe you're in a Walgreens, because I mean you're kind of in a sense
build trust.
Yeah, exactly. Yeah, I think I hope everybody that's listening to this podcast can really pull some knowledge from what we did today. We went out there and we talked a lot about what it is a pharmacist is and the professional identity, and our goal really is to let you guys know, the audience, how you guys can develop as a professional as well, whether even if you're not wanting to become a pharmacist. I think these qualities should be shared around a lot of professionals throughout many industries. So what do you guys want to go to next? You guys feel like that's all?
I guess just another thing just to talk about is just advocating for the profession, because during my interview with Dr. Medlin, we did talk about just professional identity and how there's a lot of lack of advocacy for the profession as a whole. And I guess that could be just due to like uncertainty like with it constantly changing. But Dr. Miller made it a point that since the public perceives most pharmacists as behind the counter, just clinical or community or retail, that there's more such as like hospital or clinical or even like research, for example. But compared to his viewpoint of how he views his own professional identity, is that he really enjoys being a pharmacist in internal medicine and also being a mentor and educator. But part of that passion the reason why he enjoys his job a lot is just the passion from wanting to change misconceptions about what pharmacists do and treating every patient or interaction with other professionals as a chance to advocate for the profession itself.
Yeah, I feel like also like advocating for the pharmacist, like for the profession, it also has to do a lot, not just like what is seen like on the outside, but also as the pharmacists themselves, because I feel like also a lot of pharmacists, as Keanu mentioned, like most of them, like they want to go to med school beforehand, and this was mostly like their second option. And most of them, or a lot of them, I hope that they do grow and love the career that they're in. but I feel like also some of them maybe like resented because it's not what they wanted to do. So they tell others that want to pursue the pharmacy to not do it, to do something else. So I feel like also advocating for the profession has to do a lot with how pharmacists view themselves.
Right.
It's an awesome profession, and I feel like if they really, like you said it, like if they change their point of view as like, this was my second option, they might be a little happier in life, you know? And then like you're a little happier on your work shift, like you get to get along with all the techs, all the people better, and I feel like that's something really important, you know?
And you
Yeah.
might also
Yeah.
change like perspectives of students, like instead like I guess like when pharmacists are like kind of like downgrading the profession, it's like, oh, okay, that doesn't sound fun, like I don't want to do that.
They do.
But it's
yeah.
like, no, there's so much more to it. It's
Mhm.
about like learning to love your
Mhm.
profession, learning to love what you do.
Mhm.
Yeah, I mean, if I'm being honest, I've had a couple pharmacists that kind of have driven me away from retail pharmacy because they say it's a nightmare. I mean, when I was there as a tech, I didn't mind it, but because they pushed that like, oh, don't do retail so hard, it's like, oh, well, I guess I shouldn't do retail, you know? So I definitely think, you know, the mindset and the attitude that the pharmacists, you guys, or that we all end up coming in contact with and working with, really matters to how not just we perceive ourselves and how we want to advocate for ourselves, but everybody else that they talk to, their colleagues, you know, their other, you know, students that they might have, you know, their mentees even, you know.
Yeah, and I think like for me, like interviewing Dr. Reina, it was like kind of a little bit of the opposite. Like he was like, I recommend you do retail. Like if you're someone who wants to interact more with patients, like retail's the place to do it. Like he actually shied me away from like hospital. He's like, you're just gonna be, I mean, there's different type of hospital pharmacists, of course, but he's like, you're mostly just gonna be like just filling and like just taking orders. You don't really interact with patients the way you do in retail. Like it's more, you have more things to do.
Yeah.
So I think the perspective that the pharmacist gives you really matters.
Yeah. Let's
Yeah.
talk about that. What do you guys like really want to be doing? Because pharmacy is like such a huge, like there's such a huge scope of things that you guys can actually do. What do you guys like, or what are you guys really interested in?
I'd like to make a drug one day. That'd be cool. Or at least maybe go down a rabbit hole.
It would be named after you if you
Yeah.
invent it.
Mm-hmm. That's what I'm saying. Pop in the sea bass. the Z bass, because it's going to be for sleep.
Nice, nice.
No, yeah. I don't know. I really just kind of want to see where it takes me. There's so much knowledge for us to go and get out there. And it's going to be presented to us that it's one of those things where it's like, what's going to stand out the most and who's going to go and get it, you know?
For me, I don't know yet, but I would like to have something more, because I know I am interested in hospital as well, but I know that the work hours may not be like overnight, and it's not something that I would like to do. So I would like to go into retail, but if not, I would also like ambulatory, like an outpatient clinic, because I feel like as well, like in those clinical locations or pharmacies or clinics, that you're also able to have a more patient interaction and
Right.
still maintain that like work and family balance.
Retail's good, I swear.
I don't like retail. I don't like, not to burn any bridges. I don't know who's actually gonna watch this, but I don't like retail. In my opinion, I've done rotation hours there, and I don't know. It's just not something that I personally enjoy doing.
I think it's something you
Um,
kind of get used to.
Yeah, I just don't want to.
Like me,
really-
I wouldn't like. I like my job as a tech.
Mhm.
I see myself being a retail pharmacist,
Mhm.
but because that's all I've seen. So I really wanna like I'm really depending on my appies
Mhm.
to learn and see what's out there to really like. Okay, this is what I like.
Yeah, no, yeah. I'm really excited for that because I want to see too what's more out there for pharmacy, you know?
Yeah.
Because I mean, when I started working at Walgreens was one of those things where it's like, all right, I don't know what I'm doing, but I'm getting the hang of it. Once I got the hang of it, it's like, I'm good at this.
Mhm.
I can be good at this somewhere else too. So I guess kind of that's why I want to see more, just to see what else I can be good at.
Mhm. No, yeah, it's definitely good to like expand your scope. I don't know. Maybe you guys can sell it on me, but I sell it to me, but I don't really like it. I think when
I
I
like the
first
fast pace.
You like the fast pace of it? Okay.
The days
I
go
can
by
see that.
fast sometimes.
No, yeah. I don't know. I mean, I like the hospital. The first time I interviewed there, I just kind of fell in love with it. Just being able to like not really have to worry about like the drive-through. We still fill, but it's not like crazy amounts, like 90 pills. It'll be like one pill at a time. And we'll like tube it or like walk it to the units. You know?
That is one thing I would like to learn about is like specializing.
Mhm.
Like, how there's like correct me if I'm wrong, like the ER pharmacists and stuff
Mhm.
like that. That's something I want to look
No,
at.
yeah, that's one of the pharmacists I interviewed was the ER pharmacist. Where I work, there's kind of like 4-ish types of pharmacists. In terms of main roles, there's an ER pharmacist, there's an ICU pharmacist, there's a pharmacist for the infusion clinic, and they like mainly like look at all the chemo orders, and then there's the, I guess, kind of general pharmacists. They kind of just overview all the med orders, But like the ER and ICU pharmacists are on the floors in the units. The ICU pharmacist a lot of times does rotations with like a team. So like there's a physician, the nurse is there. And then in ER, he kind of has like his own little cubby, his own little desk, and he kind of just like reviews the orders for ER, for other parts of the hospital as well, depending on how busy ER gets. But he really just helps like answer questions down there, which I think is cool because a lot of times like in hospital, they're more interacting with other healthcare professionals, which I feel like can be good and bad because like I've had nurses and like doctors yell at me before, and I'm sure you guys have doctors yell at you too. Like,
Nurses.
yeah.
Yeah, I know. Ian, I think at the end of it all, being a pharmacist, retail or hospital or industry or academia or any of the routes, I just think it's a great profession. I think it's just going to open a lot of doors for us. It's going to just help us to really become professionals within ourselves and our own identity, even in our, personal lives. And I think whether we end up staying in medicine or not, these are going to be skills that we're going to need for the rest of our lives.
I have a quick question for all of you. Are any of you guys interested in the pharmaceutical industry? Like actually like selling?
Yeah, I am. There was a guest speaker last week for like an industry pharmacist, and they showed us a lot of resources. There's I think it's a club, right? It's called IFO. We don't have one here. That's what Dr. Madlin was talking about. Plus, I guess there's just like a bunch of stuff that goes into making an actual branch for IFO here